I would really like to say what an enormous pleasure it is to be here today, and how fantastic it is that the Malnutrition Task Force is still out there really championing the needs of people who will be malnourished, who will be dehydrated if they don't have the right support in the home. So really, really great to be able to be here today and to support you. Great. So, Meals on Wheels, I think everyone assumes is a service which exists across the whole of the UK. Unfortunately, though, it really isn't at all. It is a service which actually is now available in very, very few places, but it is such an important way of improving people's nutrition and of keeping them healthy. So what I'm going to do in this brief time is just to tell you a little bit about the organisation which I am so privileged to lead, Health and Independent Living Support. We call it HILS for short. But the reason that I wanted to use HILS as an example is because I believe that Meals on Wheels should be available everywhere. It is such an easy way of supporting the rest of the system and of improving people's nutrition and wider health and well-being that the model which we've developed, we really believe should be available throughout the country. So how does Meals on Wheels work? And by the way, in the presentation, I've used lots of photos of people who we serve. So these are our individuals who have all been supported by HILS. And I wanted to use them because, after all, they are the reason that we all do our work, aren't they? These people who really need our support. So first of all, then, without going over these points again, everyone else has said today, we have a real crisis in this country. We have people living longer. We have people living in poorer health. Obviously, we know from the statistics, malnutrition is on the rise. The cost of living that we've just sort of heard about from Sophie, really, really bad. And of course, our whole health and care system is in very, very significant flux and pressure. But in England, and this is data from 2023, we now believe that it's fewer than this, but in England, fewer than 18% of local authorities actually commission or provide a Meals on Wheels service. We think it's fewer than 15% now. And so that to me seems completely counterintuitive. We've got all of these issues that we know we have in society, and yet something which we know can actually tackle these things is no longer supported. So what is our Meals on Wheels solution? Well, we know from the way that we provide Meals on Wheels that we can actually measure and improve people's nutritional status. So I think sometimes we sort of hear, well, how do you know it really improves people's health? Well, as we've heard from other colleagues today, if you don't feed people and if you don't give them the drink they need, and if you don't let them feel connected and valued, of course they are going to be unwell. But as we know, we have to evidence everything these days. We've actually been able to do research to be able to prove that people's nutritional status does get better. Of course, there's also that daily connection and support, which is so important. We're very much the eyes and ears for the rest of the system, spotting problems, making sure that people have timely support so that they don't decline, they don't go into crisis. And with the extended services that I'm going to talk to you about today, which I feel should be part of every Meals on Wheels service, we can really also tackle things like inactivity, frailty, falls. And of course, it's all really, really good value for the public purse too. So HILS, I won't go through all of its journey with you, but basically we started in 2007. We were very small. We had just 5 people working for us. Quite a lot of volunteers and a couple of vans. And now we're providing across 3 counties in the country, over 400 team members, a large fleet and a lot of different sites as well. But that journey has not only included the growth of Meals on Wheels, it's also included the development of other services. And it's interesting how these services have been developed to meet the sorts of needs that colleagues have been talking to us about in the other presentations that we've had today. So how do we fund our services. I said we're very good value for the public purse. And that is because we have multiple ways of bringing income in. So you'll see there the sort of smallest part really of that is sort of donations and fundraising. Most of our money actually comes from contributions from people who are helping to pay towards the cost of what we provide, although they don't pay the full cost. And we have contracts. So we have contracts with the NHS. We have contracts with adult care services. But basically, we have a model that means that we can provide an incredible amount of social value. We have a complex way of actually analysing our social value, but this really is great value for the public purse. And in many areas, we're able to provide our services without specific contract payments because we've been able to work with local areas to give us other things, perhaps in-kind support or a contribution, perhaps towards some of our startup costs. So again, I won't go through all of this, it'll be on the slides, but each year, of course, we do measure our impact in various ways. And just in terms of what we do, to give you an idea of size, we're doing over 1 million meals now a year. Last year, we supported around 18,000 people with lots of interventions. But all of this is measured in different ways to make sure that it is impacting people's health and their well-being. So in terms of the support that we provide into people's homes, I think that is incredibly important, because if we're talking about trying to keep people out of hospital, we need to be supporting them within their homes to make sure that their health doesn't decline and that they can stay as well as possible. So you can see here, we do Meals on Wheels and nutrition support. I'm going to talk through some of those in a bit more detail, but also we provide pop-in visits for people who don't need a meal but still need a check. We'll install key safes to make sure we can easily access people's property, and we have advocates, older people's advocates, in case they're not receiving the right health and care support, or in case someone needs to really speak for them. So Meals on Wheels, as you can see here, is a very important service because of the chronic loneliness as well that exists across the country. And each year when we measure our service, we find that actually people do feel happier and less lonely as a result of our interventions. The service itself is, as you would expect it to be, a 365-day hot meal service, also providing teas and breakfast. And of course, it's always nutritionally or culturally appropriate food as well. But just as important as the meal is the welfare check that we provide. So what we do when we go in to see people, making sure that they have appropriate nutrition and hydration, making sure that we connect in with lots of other agencies. And also reminding people about medication and checking if there is polypharmacy, if people are taking too much medication, and then referring them back into their local pharmacy or GP for a medication check. But as well as that, our Meals on Wheels service provides free malnutrition screening and information. And that's something which I think every Meals on Wheels service should be doing. It's actually surprisingly easy to do. We're also now incorporating the Patient Association nutrition checklist. It is easy to screen and then provide appropriate information. We also, as part of the service, provide extra nutrition boosts. So these are free snacks for people to make sure that they can put weight on. And when we do our pop-in visits, we can also check on people's cupboards, make sure that they have appropriate food, that they are drinking regularly, that they haven't got gone off food in the fridges and whatever, if they don't want to have meals from us. So what do our nutritional wellbeing checks include? Well, we can do initial either telephone screening or a screening visit in the client's home. And people can be referred to us because when they join Meals on Wheels, they are worried about their weight, but also a health professional can refer them, a family member, or themselves. And what we find is that quite often the referral will come from our own team members who are obviously going into the client's home daily, and they may be worried about them. They may see that their clothes are loose, or that their jewelry is loose, or they may have other worries. So we then offer up 6 months of support. We have a dietitian who works with us on a 0 hours basis so that we can access our help. We have a couple of nutritionists and our own health and wellbeing visitors. So when they screen, obviously they look for the wider determinants that may have caused someone to be losing weight. So obviously looking at issues that are affecting eating and drinking, but also things that may be making the person feel unwell in terms of their mental health. We do lots of onward referrals, and of course we provide our own specialist support as well. And again, free food boosts for people who need to gain weight. Now, something that we realised a while back is that when we provide Meals on Wheels, we have this wonderful opportunity to get an insight into how people are living. And one of the big gaps we saw was around exercise. Now, I'm sure in all of the areas in which you work, you will know that there are falls prevention services of some sort. But very sadly, most of those services are community-based. We realised from the thousands of people who we visit at home, many of whom are entirely homebound, that there is no point at all in signposting them to a community activity which they can't get to or don't have the confidence to get to. So we designed a service which takes exercise into the home. So what it aims to do is obviously to improve strength and balance and mobility, activity, reduce falls, and really increase that confidence and quality of life. And it is very much a personalized program, which is based on what the individual wants to achieve. So you can see here one of our lovely clients doing her strength and balance exercises, standing at her kitchen sink. Her kitchen counter was the best place for her to be doing that. But the program is evidence and shows real impact for these individuals. The other great thing is that we also combine some nutrition advice. So if we are worried that the person is not eating well enough, we all know that protein is incredibly important if someone is going to build their strength. So we can also refer in the person may need Meals on Wheels or other nutritional support as well. Latest statistic from our last year survey there, that 72% of people on this service say that their general health has improved, and 79% say that their mobility is improved. And these are people, the majority of them are in their 80s. We also have people in their 90s and 100s. So this is very significant progress for those people. Now, we measure the impact of all of our services. So for active aging, we measure it using a number of validated tools. If any of you work in the area, or obviously clinical frailty tool, but Berg and Fratton and other tools. And we're able to see that actually people's balance does improve. We phone them again after 6 months, and we have seen that there is a real improvement in falls. Far fewer people fall afterwards. And also, a piece of work that was done by Public Health showed that people need far fewer adult care service interventions as a result of having gone through the service. But as well as that, we also want to support at times of crisis. And so we have a number of other services, again, that link so easily to Meals on Wheels support. We're out across our areas in cars with well-trained team members. So why don't we also take out support into the community? So we provide a food bank on wheels, which is effectively bags of food for people who may be younger, because of course Meals on Wheels isn't all about the elderly, who may be in financial crisis and may not have the food that they need to stay well. We provide emergency foods for day centres and residential care homes. We provide food for people leaving hospitals. So we have ambient food banks that we leave in hospital wards. The integrated care teams can hand them out. So as people are leaving late at night, they can go home with food and support. And also we can provide free meals for people who are being discharged from hospital, or also on hospital at home wards as well. Just to tell you a couple of these in a tiny bit more detail, our post-hospital support really does help people to regain independence. And we've been able to show that it really does reduce the chance of readmission, and it helps people recover. Now, again, as Hills has developed, we realised that we need to keep people connected. And there are some people who are able to, through Meals and Wheels and our other support, are able to mobilise outside their homes again, which is fantastic. So we also have health and wellbeing hubs, a number of lunch clubs that we run, and we support other Age UKs and other groups to run them. We have our 10 to 2 clubs, group exercise sessions, and also dementia support as well, which I'll just tell you briefly about. So this is really fun day clubs that we offer so that we can provide unpaid carers with support, doing lots and lots of different things that won't surprise you. But you'll see within that, nutrition is also really important, as is exercise. So whatever we do, we try and take the importance of eating well and drinking well and enjoying eating and drinking well to the heart of the activity, because we know that that then helps with the other underlying issues, such as dementia, that we are trying to support. Last section is around support for groups, and obviously we'll provide food for other lunch clubs, but also for day and residential care services. Everyone can face a crisis. Chef goes off, they need emergency support, we can help with that. And we support more small charities as well. But our nutrition awareness training is something which has been shown to work brilliantly, because it helps us to support within care homes. So in Hertfordshire, where the service runs, I think if we had Alison Smith, our lead dietitian, on the call with us, she would say that we use fewer oral nutritional supplements in our patch almost than anywhere else in the country. And part of that is because of the food first approach, this desire to help people to understand how food can be so important for people. So obviously we train people in how to use must. That's something which I'm sure all colleagues will know can be challenging. But what we do is we train everyone in a care home. So whether the person is a cleaner, they are an assistant, they work in the kitchen, whatever they do, everyone is trained to understand the importance of their role in providing good nutrition and hydration for all of their residents. Of course, we train them for food fortification as well, so that everyone has what they need. So finally then, just to conclude, what's the future for Hills and for the system? Well, for us, we do want to see this across the UK, and we want to work even more closely in partnership with health and social care. So if you have any ideas today, or something that you think Meals and Wheels services should be doing, or you'd like to include some of our services in your Meals and Wheels service, then please get in touch, because we would love to be able to speak with you. So thank you, everyone, for listening to me, and let's all feel positive about what we can do in the future together.
Well, Sarah, that was brilliant, because there's so much going on. But what I think is impressive is that you're meeting those needs on a local level. And that's really important, isn't it? If we're going to keep people well within our local area, we need to provide what they actually need. And 1 million meals in a year, that's really a lot. And it does help to prevent the crisis. And I think all the things that you've been talking about really fits in with our ask, look and listen and act upon what you're seeing, particularly around medication, because we know polypharmacy is a really big deal for many, many older people. And to get them, to encourage them to have regular medication checks is really important. So thanks ever so much, Sarah. That was so interesting.